Hello, hello everybody. Whoever is here, 3 people are here. More people are coming. I'm starting the stream, and I guess I'll just wait for a little while for maybe a fourth person to join. How about that? But if they don't join, we will just start. So you will see that there are some links already in the chat. Those are links to the recommended videos and literature on the topic that I'm going to be speaking about. So I would say that probably you don't need to open them right now, but after the talk is over and you're curious, yeah, they'll be there for you. So today's topic was brought about by the recent news about Hillary Hahn, that she withdraws from concerts for a while due to the double pinched nerve, as she announced in the Instagram. And so to me, it was quite unbelievable that such a person as Hillary Hahn, who is the embodiment of proper playing and proper positioning and flawless technique, one of the best players on the planet, and everything is working very well, and meanwhile still gets the professional injury. Even though we don't know specifically what double pinched nerve is, but nevertheless, it's a professional injury here. So I am told that there is an echo. All right, let's see. What do I need to do? Anything? If there's anything speaking. I don't see anything. Anybody else is hearing the echo? Okay, let me see if I can close other tabs here. Maybe there's something open there. All right. Okay, so how is this right now? Is good? Echo is gone? Okay, somebody did not hear the echo. Oh, great, fine, perfect. We fixed it. I fixed it. All right. So now more people joined. So now I guess I'll repeat the intro. But before I repeat an intro, okay. So there was an interesting thing. Anytime I lean one direction or another, I was told by my friend last time that these letters FU by my head, they're not what they might mean. They really are Firmax. It's actually a game chair for people who are doing gaming. I got it from my son's family. They're the gamers. But here it's actually nice because it has back support. Yeah? So no, yeah. So this is what that FU stands for, or fur. Okay. Again, back to why I'm doing the stream now on this topic is because of Ms. Hahn, Hillary Hahn's statement via Strad magazine and also Instagram that she is withdrawn from playing until, I believe, September due to the double pinched nerve injury. And that brought me back to a well-known fact that by now, of course, the previous belief that any injuries that one can sustain is only due to poor technique is absolutely false. It's absolutely false because this woman is an embodiment of perfect technique and perfect execution and actually her posture looks good and everything is fine. However, she does have this, and many other people also who are flawless, seemingly flawless in their posture and the way they play violin and the technique that they have, they still may get professional occupational injuries. Okay, so I decided to give you a little bit in insight on that. Now I need to immediately make a disclaimer. I'm not a doctor. I'm not pretending to give you medical advice, but I have experienced myself and with countless students and colleagues around me various issues that come up. For instance, everybody's, of course, familiar with tendonitis, right? So everybody knows what tendonitis is and knows what, I hope they know what to do with this. So when your muscles. Tendonitis is related and mostly primarily to muscles, because tendons are the ending of the muscles connecting to the bones, correct? So it's usually connected to overuse, but not many people know that if something hurts in here or in here, which would be the typical tendonitis sites, that a lot of times the issue might originate still in your shoulder. Okay, so I will talk about this a little bit. And of course, there's one group of injuries very common is overuse, just simple overuse, meaning going to tendonitis. And the other one is also overuse, but less visible. And that has to do with pinching of the nerves or entrapment of the nerves or compression, nerve compression. But as I said just right now, tendonitis also can have very much nerve compression origin, as well as an overall nervous system condition and physical condition. So here, all of these topics are all in one, and I want to talk about them and also have your questions, of course, because many people experience this or that, and it's much better to either hopefully prevent injuries, or at least recognize them quickly and do something about this before they get too ingrained, and then you have to stop playing and you have to start long recoveries, sometimes really long recoveries, and so forth. So with that, I believe that I have to give you a little bit of anatomical structure so that we understand why tendonitis and nerve impingement they have something to do with our neck and our shoulders. So what happens, of course, what are the nerves? Nerves are they carry electrical current. Basically, they carry electrical current from our spinal cord to our muscles. If this electrical current is interrupted anywhere by compression of something, either it's a tensed muscle or it's even a bone that moved due to the tensed muscle for a long time. So if that happens, then what happens with the electrical current? It gets reduced. So it doesn't carry that much information into the hand, to the forearm, tendonitis, to the hand. We start having fatigue. We start having tingling, could be numbness, or just weakness. Weakness usually is the first symptom. And weakness, again, it's not that weakness that you can't hold a pencil. If that gets to that point, that's a lot of weakness. But it's a weakness just to feel like, I'm playing I'm playing double stop, and so sometimes I don't feel that my fourth finger is like really getting there with the same strength as my second, for instance, does. Like, okay, so if that occurs, that's already a sign of weakness, and you immediately need to think, what is going on? So what is usually going on? Now, we need to know that these fingers, pinky and half of the ring finger, are governed primarily by the ulnar nerve. So ulnar nerve, for us, we have to think that it's here and then goes here. But all the nerves, so radial, median, and ulnar, and yes, we have three big nerves also axillary, but fine, we'll just go with the three well-known ones. Radial, median, and ulnar, they all start here. They start in the spinal column, of course, and then they come out from the neck, the different vertebrae in the neck. So from C5 right here, and down C6, 7, 8, and T1. So after that, from coming out of different vertebrae here, these nerves go underneath, basically scalene. There's a scalene muscles here. They go underneath the collarbone, and I'm showing on my left arm because most of the time it's our left arm that is involved, or hand. So under the collarbone, through pectoralis minor here, and into our armpit, and from there it branches out, sort of like a freeway system, okay, with different connections in between different roads. And so what happens is that Nerves, I mean, there are really good anatomical pictures on the net if you're curious to see. They intermingle. Most of nerves go into every one of them, I think, feeds into the median nerve. But for us violinists, the nerve that it gets most affected is usually the ulnar nerve, and which leads to impingement here, or cubital tunnel syndrome, it's called, and it's affects the pinky and the half of the ring finger, but we kind of feel like the whole ring finger, really. So anyway, that happens why? Because of our posture, because this is constantly bent. By the way, this will be, any nerve will be reacting to the constant bending. And we a lot of times are in this position. No matter how great our technique is, we're still in this position. Now, what else do we do? We have to have rotation of our forearm, right? So that the pinky can get to the fingerboard and all of that stuff. Nice, wonderful thing right here. Yeah. So here we get this. This is what we have here naturally, right? Not, we don't play like this. That would be better anatomically, but we have to do this. Okay, so then we have that, we have bending, and then we play in the high positions right here. Extreme bending, that's everything is crooked, and then we have to vibrate. Of course, poor ulnar nerve gets a lot of workout, and or muscles that it governs also working a lot, right? So meanwhile, so by itself, it can cause problems. In the general population, people can have ulnar nerve entrapment just from sleeping, sleeping some hours of the night with their bent elbows, doing nothing. And here we are, we're performing complex functions and with vibrato, which is a very big load on this. And we are doing it completely in a static position of many other muscles. That's probably the most dangerous thing in our profession, is that we are in static positions just by virtue of playing our instruments. We're in static positions. So I will right now not go to the chat yet. And also, if you want just in case, if you want any questions or your question to be answered for sure, I recommend I think it's called the top chat, or maybe not top chat, but priority chat. Anyway, when we have to pay a little bit, and then I see your question already, it's highlighted. Okay. Otherwise, depending on how many questions, I may miss them. So, back to our static position. So static position is really the cause of every evil that we can experience. And that, in my opinion, probably is the case with Hilary Hahn. Because as I said, technically, this woman is superior, which is amazing, technically, violin technically. But the loading of the body. So let's just look at what we have to do and how many hours a day we do this. We know that what is called static positioning or static loading. I actually would like to read you what it means, because there's a very nice explanation, definition rather. Static posture, it's called these days, used to be called static contraction, but now that there's an exercise that bodybuilders do that is called static contraction. So if you Google that, you just only get those results. That's not what we're looking for. We're looking for static posture, also known as static loading. Okay, static posture, static loading refers to physical exertion in a fixed position or posture. And what it is, these are standing, yeah, muscles are supporting you to stand. Sitting, muscles are supporting me to sit, and even lying down sleeping, which was a surprise for me. I thought that sleeping is ultimate relaxation. Nope, even that is not. And what do? We stand there in a wonderful position with our arm constantly slightly to the side, constantly like that, and slightly turned. So without any violin, if we're just going to stand there for a while, and many of you maybe have done this experiment, you just stand there and you just hold it there. So do you know how many muscles are involved of holding our arm up like this? Quite a few. And it will be not only in the arm, it will be, of course, here and in the back. And those people who had problems in the back, they know, oh, when the back is sore, you can't do that. it's not, you will feel pain. So anyway, so we stand like this, and how long will we stand without feeling really fatigued? Not too long. Some people can stand longer if they're in great physical condition, physical shape. If they're going to the gym, if their backs are in fantastic shape, they will be able to withstand longer. So that points out that we have to maintain our physical conditioning. We have to be strong enough. And how many of us, the weakling musicians, hear this sort of advice? Well, not much until lately. Now, finally, it becomes known that we're athletes, that we have to have condition in our body. We have to have strong back muscles. We have to have strong arm muscles. Yeah, and the stronger your muscles are, the fewer problems you actually will have, just because we have to do this, holding ourselves in static position for a long time. So uh, basically, yeah, static position is what the limbs are working still. I mean, the muscles are working constantly. So as I said already, the time that you can maintain a certain static posture varies. First of all, varies on how difficult the posture is. One thing is sitting, another thing is standing, another thing, for instance, is a plank. Plank is also, it's a static position. How long will you hold the plank comparatively to how long you can sit? Well, it's obvious. Our position here, maybe not a plank, but certainly much more taxing than sitting or standing with this support. I remember when I was little, I used to do these stupid things, really, like practice. I would want to practice 10 hours a day. In summer, no school, I have a break. I will practice 10 hours every day. I wanted to be a really great violinist. Well, after 2 days of attempting 10 hours a day, of course, it's not really 10 hours of practice, but let's say 8 hours I would practice, but 10 hours I would be with violin, around violin. I noticed the following. I just couldn't hold my arm anymore. I was very surprised. I was, I think, 15 years old back then, or 14, 15. It's like, why can I hold it? I mean, I heard about people practicing that many hours. It should be fine, you know? But it was just to the point that it would be like here. I couldn't bring it up anymore. So I would keep practicing very smartly. I would keep practicing like this. I'll just go like this and still keep playing my passages and whatever, just resting my poor arm instead of resting altogether. No, I had a goal to practice 8 hours, 10 hours, whatever. So not only that happens, if we have too much fatigue in here, and usually our muscles here are not sufficiently developed, 8 hours shouldn't be done. It's wrong. Although some people can do 8 hours a day, unless, of course, with frequent breaks. So basically, you want to come out of static posture as often as possible. Therefore, to my students, if any of them are here, they know even when we're in a lesson and they're listening to me, and doing like this, I say, no, relax. Don't ever hold your violin in this position. If you play with shoulder rest, like I do, for instance, and quite a few of my students, maybe not most, but quite a few. So don't hold it like this. It's still burden. Just rest. That's already a very, very good thing to do. Yes, with what you're doing. So then, if you're playing with a shoulder rest, other problems may arise. If you're playing without shoulder rest, yet other problems may arise, and that there are different problems. So, for instance, you play with shoulder rest. How many of us are doing what is very bad, what I call cradling? So, if I'm holding my violin here and it just holds there, that's what shoulder rest is for. So my shoulder actually is just in the same position. I don't lift it. I don't lift it to help. But a lot of times it feels like it's not enough, So we'll do this. Just maybe a little bit, not even that noble, just like that much, okay? What does it do? Well, it secures violin a little bit more, just a tiny bit more. It secures it. This way, it's not secured. This way, it's slightly secured. Do you see the difference from that angle, not secured, now secured? Not really. It's very, very little. It's more of the feeling right around here. But how many of us doing it? A lot. So that's additional. Now we have muscles of the upper muscles here, right? Engaged and holding. And what happens over time, you practice the whole hour, and this thing maybe just standing there for the whole hour. Maybe you relieved it once and then it went back. So after a while, it realizes, this is not going to happen. So I'm going to be in this position. It gets used to this position. Obviously, it doesn't relax anymore fully. That's when we usually go to massage therapy if we can, or we don't notice. And then I had students who literally would have like growth. It looks like a growth right here, but in fact, it was a spasmed, bunched muscle that we just forgot how to release that contraction. So that's very bad. So now, where is it, that muscle? If it's here, it's close to the opening and coming out of the nerves. Nerves are just coming out. So if you constantly have that, you're compressing all of those nerves, and perhaps some will be compressed depending on your physical structures. Some will be compressed a bit more than others, and different people will be different. For most of us, I think the cubital tunnel, so the ulnar nerve, gets compressed most. It's just by observation. Again, it's not I don't have statistics on that. It's my personal statistics with most of my students, if they have that thing. So, but meanwhile, yes, everything gets compressed. So you have pinched nerves here. Then when they get all of them, and that is called brachial plexus, actually, all of this, 5 or 6 nerves, and they kind of merge into 4, and then they branch out again. And anyway, so they're called brachial plexus when they come right in here, strands of them going into armpit and out. So, yes, it could be the pinched nerve, one or more, can be right in that area. It can be in this area coming under the collarbone. It can be pinched. It can be pinched here, of course. How? Well, what is this? Remove the violin. Look at how we are. We're rounded in there. There's nobody who can play violin here. It's not possible. So we're naturally going to the violin. Okay. So, but what we should do then when we are not playing violin, the moment we play it, go stretch. How many of us truly really stretch? We start stretching usually when we get an injury, but we should really prevent injuries. So for that, I highly recommend for you to go and look at my videos, because here, there's my videos. I'm reminding myself. So the videos on the posture, posture. Why is posture important? Well, because if posture is like this, what happens? Compression right there is happening. Compression right here is happening, right? All of that. And it's without even work. We're just already jeopardizing ourselves if our posture is bad. Then we go to actual postural inevitability of some squeezing or some closing. That's when we need to do the stretching. Stretching can be done before we play, or should be done before we play, and after we play especially. Okay, so the corner stretch, I think I have this corner stretch exercise is especially great, because that it helps to relieve all of the compression here. Anyway, so back to the nerves, as opposed to tendonitis. So what to do if one has a nerve injury? First thing that we have to stop playing, unfortunately. While in tendonitis, it's possible to rest a little bit and then start rehabilitation, so to speak, just to practice a little bit. With nerves, it's not possible. So it's very important not to get to the point when the nerve is really compromised and pinched anywhere on its way to the hand. Okay, and it can be pinched, as I said already, everywhere. It can be here, there, here. Oh, it could be pinched in there, by the way, too, in the armpit itself, and then coming up the armpit. And there's several places here, on that side and this side, anywhere. And of course, carpal tunnel. Everybody heard about carpal tunnel, and so on. It's just anywhere it can be deficiency and contraction that is compression that is not being relieved. Okay, so it's very important not to get to this point. You have to start playing, and you have to immediately go to physical therapy. Don't try to do it. Well, I mean, you could try to do it, but you never know which nerve exactly is involved. Sometimes they will do, like, somebody has a carpal tunnel, right? And they even go after surgery. they do the surgery. Surgery is here, right? They relieve the situation right in here because there was compression. But meanwhile, the person is recovering from surgery. They say, then again, no, I still have problem. Why? Well, because there was another pinching somewhere, and that wasn't ever relieved because nobody cared to really check all the going of the nerves, all the way down from the neck, from vertebrae, and into the hand. And there was some kind of other issue that never got fixed. Okay, I had a problem personally myself with the cubital tunnel at some point, and I was just going from doctor to doctor. It was like many years ago, 25, more, almost 20, almost 30 years ago. And I had a problem there, and I went to medical doctors all day. Everybody was telling me surgery. Yeah, if it keeps progressing, so far you're okay, but it already bothers you, so surgery, eventually surgery. And I didn't want to do surgery. So eventually I found a doctor who was not a surgeon, and he found that I had very tight muscles, very tight portions of the muscles. I mean, he just basically found them where in the muscle where those things are, and one of them was in my armpit. And so that was aha moment for me. So luckily I found that particular doctor. He did these particular releases, trigger point type of releases. uh, I went there for several weeks, 2, 3, 4 weeks maybe, and it was gone. My ulnar nerve problem was gone. There was no reason to do a surgery. So that's how powerful the muscle tension is, and how much it can damage, put compression on nerves, and basically start damaging the nerves. Luckily for me, I could avoid surgery. So, okay. Back to the falsehood of, oh, still that can happen only for people who do something improperly, whose technique is not very good. Oh, that's what it was in Soviet Union where I grew up. That was the current theme. Oh, technique is not very good. That's why you have problems. Oh, that's why you have tendonitis. Your technique is not very good. Okay, I had tendonitis myself all over my arms. First started the left, here, there, and then started having in my right hand, even though this is not as old. So I was about 19 years old. So luckily, we had a very good doctor on the premises of Moscow Conservatory where I was studying at that point. And she examined, she was a medical doctor. She was neurologist by her main profession. So she examined me and said, oh my God, I mean, your nervous system is in bad shape. I will take you to the hospital. Now, we had a specific hospital for occupational, professional and occupational diseases, it was called back then in Moscow. So, and, luckily back then it was available to everybody. So she put me there for 2 weeks, inpatient, and started treating me. So she was treating me with acupuncture, by the way. In that former country of mine, acupuncture was a completely normal medical device that they was used in hospitals. So it wasn't considered to be alternate medicine, alternative medicine, as it's called here. Still, no, it was, medical doctors were practicing it fine. So this and a lot of other procedures also, like baths, massages, excruciating massages of the neck and upper back, going into lower back and up until here. Nothing ever here. Even though my pain was mostly in my forearms, no massage was performed on forearms. And they were telling us, never, ever, ever allow anybody to perform like deep tissue massage on your forearms. You don't need it. It's very dangerous for us, for musicians, or on your hands. So, but it has to be performed all the way here. And some of that is in front here, the pecs, and in the back, yeah. So that and some electrical stimulation, that sort of thing. And lo and behold, one time I was there, inpatient, right? I was staying there for 2 weeks. And then one time I was going in the corridor, and who do I see? And I had I had a double take. It was Leonid Kogan. Kogan was one of the absolutely best violinists, speaking of technique, in the world. Yeah, if you haven't heard him play, go listen to his Paganini recordings. They're on YouTube. Leonid Kogan. And here he was. He was on that. And so then I looked at him, and then I asked her, I said, well, I saw Mr. Kogan here. I said, oh, yeah, he comes here every week for relaxation things. Okay, so nothing to do with technique, obviously, but the fact was that he was a very high-strung person. He was very driven. And yes, if you're high-strung and very driven and perfectionist, and you have a certain conductivity in your muscles, which of course we're born with and we don't know, yeah, you are more prone to get more tension in your muscles. You also can get more tension in your muscles if you have low tone muscles. If you're born with low tone, which many people are, and we, of course, we don't know until we start experiencing stuff, you know. So that again, back then it was clear to me that it was not relating only to technique, and yet that prevailed, that thinking prevailed in former Soviet Union. So you kept your mouth shut and you never said to anybody that you were hurting. Of course, Kogan would never say to anybody either that he had problems with musculature problems. It didn't affect his playing whatsoever, but he would stop playing for a while. Or we know that Maxim Vengerov stopped playing for a while. Again, he didn't announced it like Hilary Hahn did recently, but meanwhile he stopped playing for probably a year and a half. And many other people, many other violinists stopped playing for a while, recovered from whatever injuries they had, and a lot of times rethought how they were moving. So now I would come back to the other dangers, for instance, playing. So this was about shoulder rest. It's again static. The muscles are contracted all the time, especially if you hold them more than necessary, right? But what about playing without shoulder rest? Many people who play with shoulder rest and experience these problems, they shift to playing without shoulder rest, and it may help a lot if your hand is very strong, if your arms are strong, okay, and if you have very good stretchability here, that you can go into very high positions and not leave the neck. Then you're a good candidate of playing without, if you're professional, without shoulder rest. But there's another issue. If you manage to do all of that correctly without raising your shoulder, without doing this, right? Great. It could really free you up in this region. Most people cannot do this. Most people think that they're doing it, and meanwhile, they will use a little bit pad, here and there. But meanwhile, if you look from the back at these players, very well-known players too, you will see that they still do this. So basically, there is, but still, maybe there is a little bit of advantage because they still maybe are putting down that shoulder at some points. But so you can put down that shoulder in some points when you play with shoulder rest. So that shouldn't really be make it or break it. However, if you constantly played with one and then you go without one, you are more likely to feel better your shoulder because it would be in a different positioning. You know what I mean? However, why people invented shoulder rest, as today's lecture is not really about that, but nevertheless, just to explain why people even invented shoulder rest. I mean, just because? No, because too many people in the old days played not like this and doing everything properly, with the arm and having really strong arm and having fantastic coordination between different muscles of the arm and different muscles of the hand and all of that. But they were really doing this. They were holding the violin here with even much more force than we do nowadays if we use the shoulder rest. So, and that of course led to many innumerable issues of many players, or just, you would see a person who would be like this, and they would be just walking like that because their body forgot how to drop that shoulder altogether because you played so much in that position. So static positioning is a problem, whichever way you do it. So what can we do to prevent it? Breaks, frequent breaks. How long is the longest piece that we play without a break, without putting that arm down at least for, I don't know, 2 seconds, 3 seconds, 4 seconds? What is the piece? As far as I know, Chacon, Bach Chacon. Used to be 15 minutes. Now we play it in faster tempo, 13 and a half, 14 minutes. Okay, so 14 minutes, you should be able to stand like that and support, okay? Not more. So anything that we do in practice, and in practice we really don't need it, right? We have to put this thing down and make some adjustment movements so that we release that tension. It's very important. Again, please go to my videos and learn how to do this if you haven't been doing this already. So that second thing, physical conditioning. So now I want you to read again from what I found here. Just a second. So that static posture, right, that we are dealing with constantly. So how when discomfort develops, it a lot of times based on the posture itself, of course, right? Then the muscular effort required to maintain this posture, like we discussed. And second, lastly, person's physical condition. So I hear from more and more of my students. Most of these students are boys, not surprisingly, but hey, they're giving all of us a wonderful example. The stronger the person is, the less they hurt. Simple as that. They go to the gym, they lift weights in a knowing fashion. They have fewer pains and aches. I have two people right now in my studio who are great flowering example of this, maybe more than two. But also, of course, I have some girls who are very strong in doing the same exact things. Yeah, it's absolutely. I have several of my students in professional orchestras, and those who are going to the gym 3-4 times a week and doing weightlifting and working with machines and doing a lot of exercises, they don't hurt. Of course, they're also aware of the things that I'm talking to you about right now, but they don't hurt because they maintain great physical shape and stamina. So you do need to have endurance to play. Like you to play Brahms concerto, you have to have endurance. You have to have all muscles working, support in the back, support in the lower abdominals, definitely, because you don't want to arch your back. And the only way to protect your lower back from that, and standing. I mean, standing, it's endurance too, because the Brahms concerto is 45 minutes. You stand in one place, and that by itself is a static posture that leads to problems. Just doing nothing, just standing for 45 minutes can lead to problems. That's why we shouldn't stand. We should move a little bit, but not, I don't mean theatrical moves, like not long, not long, not reaching, not that kind of movement, but just physical movement. Bending the knees slightly rotating, slightly, moving in a spot already is helpful when we perform for a long time, when we stand for a long time. But when we practice, we don't need to stand that long. We need to train to stand that long. Okay, so I think I might stop in here and now take your questions. I mean, there are a lot more that I want to say. Of course, I could say, I could probably give you a lecture for a couple hours on that topic. Also, there's this book that I highly, if you have any ailments at all, I really recommend this book. Let me get my glasses to help me. Where is that? Oh, that book, link to the book is on Amazon.com. It's Musician's Survival Guide. So I have a very old edition of that, you see? 3 mice. 2 of them have patches of their eyes because the bows broke the eyes out. So anyway, yeah, it's actually an old book, 1993, my edition. I don't know, maybe not right now. They have some newer edition there. But yeah, it's really great. I mean, it talks about everything that it can possibly be wrong with instrumentalists, and violin is featured, of course, is probably the most injurious instrument, violin, viola. Yeah, highly recommend to get that book, anybody. Okay, so let's see. I heard there's something called Alexander technique. Yes, Alexander technique, of course, is helpful. Absolutely. Alexander technique, Feldenkrais, it's another one. Technique. Pilates, incredibly helpful. Yoga is helpful if you do it correctly. Anything that gets you aware of your muscles and strengthen muscles and also stretch. And Alexander technique is not so much about strengthening and stretching, it's posture. It's posture related and moving in this posture. And also the Feldenkrais is the same thing. I mean, it's not the same, but it's It's similar in some ways. It goes for the same result. Um, in cases of skinny tall violinist with a long neck who refuses extra tall chin rest, shoulder rest, or shoulders, yeah. What are the suggestions to avoid injury? The physical sensation of movement are essential. Skinny tall violinist with a long neck who refuses any kind of a reasonable help, right? Well, they have to support the violin with their arm or with their hand, basically. That's the only thing then. Because yes, I mean, this. So if, I mean, I also, my chin rest is quite small. I mean, the case could be made here that I need a taller one, like this, and probably maybe, but you know what, I'm used to it, and the fact is now I'm using it. I'm using my arm a lot. So one year I decided to learn to play without shoulder rest completely, and so I switched. I had another chin rest though. My then chin rest was center. So, but yeah, I learned how to play properly without raising my shoulder, and just also feeling the violin much more on the thumb when it's in higher position, or between the thumb and the first finger, which I touch anyway, even when I play with the shoulder rest, when it's in lower positions. So once you learn that, you learn the act of balancing more. But yeah, you start having load more on your bicep. I would say, yeah, bicep and somewhat of a tricep. Yeah, you have more load is in here because you're actually supporting that weight rather than the weight passively resting on the shoulder rest, most of it, and the collarbone. So with the shoulder rest, we support that supports, collarbone supports, and the hand supports very little or nothing. But it can support a little bit. That's what I use now when I return back to playing with the shoulder rest. And why I did this, because I don't have enough stretchability in my hand to safely play in higher positions. I have to go here or there, to play in these positions. I have very short fourth finger. It just won't reach otherwise. So for that, if without shoulder rest, I don't want to go to that stuff, and then it's just too big of a motion. But what I learned is not to clamp, basically. So for the tall violin and tall neck, well, I would gently move them towards the idea that they don't want to be their own worst enemy. Yeah, just because the great masters out there, who usually are all short-necked people, um, just because they play with visibly very low setup here, and perhaps even without shoulders, it doesn't mean that they don't hurt. It doesn't mean that things are not going wrong for them. So yeah, anyway, so that's what my suggestion. Okay, next question. Let me see. I got diagnosed with chronified pain syndrome. You can apparently still have pain after injury has healed. Yeah, you can. Then you can re-educate yourself probably in terms of pain, but it's a different topic. I won't go there. Hello, Lucy. Oh, thank you. I'm wondering, what is the longest recovery time you have seen? I've been unable to play for 2 years and seen that like the pain might never go away. Well, depending on what your pain is, what causes it. Sometimes, yeah, nerve pain usually should go away by itself. I mean, with proper some treatment, of course, should be there. But you cannot, for instance, with nerves, usually it's not recommended to ice, which is a great technique when you have tendonitis or just a regular overuse, muscle overuse. Then we ice after we work, and then we warm up before we work. But with nerves, it's different. They don't like icing usually. I mean, you can try still, but I don't think they go with it. So I would say, well, depending on what the injury is, why it was there to begin with. Sometimes there's injury because of, let's say, bone spurs. They develop with that with life. Sometimes early. They develop early. So some people can get bone spurs at the age of 25, rarely, but still could. So if the bone spur is there, there's nothing you can do unless you remove the spur somehow. And I don't know if it's possible or not. So I don't want to sound discouraging, but yeah, it's depending on what it was. Hello, can you help me please with playing on the upper in the upper half of the room? My wrist bends in weird direction, bow turns. It's a mess. Is not long enough, which is not true. Okay, this is more of a technical issue. It's not the issue of this live stream, really. Let me see other people, and if I answer all the questions relating to the injuries, I can return to this one, okay? Do you have any suggestions of how to manage a good, healthy body with injured history with the high amount of playing hours? Yes, I do. Unfortunately, that only means that you'll have to do a lot of exercises and stretching. So first, before you play, you have to do the whole round of stretching and warming up. And I have a video, I mean, it's up there again in the beginning of the chat. I have a video on that, the warm up and cool downs for musicians with injuries. I do know people who have been injured early enough and then managed to recover and managed to have went on to have full professional lives with very good results. But it is a lot of self-discipline. So with injured history, exactly. So high amount of playing hours, frequent breaks during the playing, watching position, reminding yourself if you're playing with shoulder rest or without, reminding constantly, can I let go of something? You know, you play, you know, you will play in high positions, you know, even if I'm conscious about not doing this. Going in high position can still happen. I go into lower position. I remind myself to let go, of some muscles there. I don't care what muscles they are. I just let go of the sensation. So that helps a lot. You have to get used to it also. And then cool down after playing. If you had injury at certain side, icing it once in a while. When you ice, I prefer ice massage rather than sitting for more minutes with ice pack. Ice massage is shorter, and you also can see the result. If you really are injured, the area that you're icing, for instance, whatever I'm showing it here, but fine, it can be anywhere, it will get red really quickly. If it's not injured, it will still pale. It basically will not get red, or maybe just tiny bit pink. So that's one thing to watch. But yeah, basically, yeah, it's, and of course, do exercises for the whole body, for important parts of the body, all upper body exercises to keep in good shape and conditioning. So, hello. Let me see. One of your followers on the channel. I want to ask a question about me playing the violin without the shoulder rest. Does this cause injury over the long years? Not necessarily. Not necessarily. As I just said, you know, if you're playing properly, if you're watching that you don't do this and you don't play in this position, you don't support with the shoulder, or if you do support with the shoulder, it's for a very short time, and then you're conscious about dropping it to regularly relaxed condition. By the way, isolating movements in muscles, let me rephrase, isolating the muscles that work when we raise our arms. I also have exercises, I have a video demonstrating that with one of my students. Unfortunately, I think in that video, we're still in masks. It was at COVID time when we could not do anything without masks. We're not allowed at the university. So I think that's the mask video, but you know, just bear with that. But yeah, I show the whole sequence of how to relieve yourself of tension and also realize that you have that tension and how to drop a certain muscle without dropping others. You know, it's a very good one. So without shoulder rest, yeah, you have to have strong hand. You have to be able to move while supporting violin here, or while basically supporting more weight of the violin on the thumb when you're in higher positions. And if you do a little bit of that and it drops, yes, you can be fine for many years. But again, just watch out that you don't stand in this position for too long without breaks. 15 minutes tops. Okay, so Jackins, dear Julia, on the other stream, you mentioned some books about mental practice. Yes, I did post them. I did post that book on that other stream when I was talking about this. Yes, I posted. That mental practice, of course, is very useful. Thank you. Yes, it's very, very important when dealing with injuries, because you can practice really practice without overusing your body altogether. So, but that book, again, both of these books are quite old. They're not new. They've been around, and it's just a matter of discovering it. But yes, I put that one. I have this weird thing. I constantly forget her name, the woman's name who wrote that one book. And I couldn't remember that during that live stream. And then I remembered this. I found it. I posted. Now I can't remember her name again. Unbelievable. Anyway, it is posted. I'll post it again under this here, okay, for you to read. Yeah, thank you. Do all great violinists have perfect pitch? Can it be developed? No, well, I don't know most or not, but many great violinists do not have perfect pitch. It's not necessary at all. What we have to have is a very well developed relative pitch. What is perfect pitch? In lay people's language, perfect pitch is basically what we all have, what I have, what my partner has, his pianist and composer, or just my parents, my whole family has, what laymen will say perfect pitch, because we hear every note on violin, on the piano. I can hear every note on a cello. It's not necessarily perfect. If you can, you should be able to hear the pitch and immediately tell what it is. If the sound is made by anything, car horn outside, train, on a pedestrian crossing, I don't know, voice singing something, or oboe or trombone, anything, right? And the person immediately can tell what this note is. Those people have perfect pitch. But for most people, we have perception of the pitch is colored by the timbre. So when you practice on a certain instrument, then of course you can tell each note. And that, yes, this is very well developed, and it of course can be developed. So you just have to be developing it. Write dictations, musical dictations, sing, repeat notes on the piano, listen to the piano, repeat the notes on the violin, on other instruments, here, kind of put them in there. Yeah, it's very developable. And that's what we need. What would you suggest to do if your student feels fatigue in left thumb? That's a very good question. Now, first of all, I would ask where fatigue is, in which joint, and then I would look at the position of the thumb, because there are several things that we can have in our thumbs. And main for women, where women usually are very lax, we have a lot of laxity in joints most of the time. Some men are the same, not only women, but women most often. And so therefore we can have improper functioning of the joints when we support something. We have, oops, let me put this thing down before I lose it. Or on the right, maybe on the right thumb. I don't know how you can see it, here or there. Let me see. Here, maybe. So we have to have this bump, so to speak, that's a joint, and this joint also out, right? The same thing by the pinky. The best position, of course, is this, when this joint is out, and this one, or knuckle, or whatever you call it. Okay, so that's a support. The same thing as this. So a lot of times when we play, and if we're what is called double jointed, which of course is wrong, we're not double jointed, we're just lax in our joints, we're too loose. So what happens, like, look at my thumb right now. So this is when it is being supported, you see this little, and this is when it's not. So here I'm pressing something down, and you see how it went down completely. It's completely straight now. So instead of being out a little bit like this, it just goes completely, I have not to look at my own thumb, goes completely in like this. So for some people, if you do this for a prolonged period of time, because you just never realized even that that's what happens, it will start causing pain, or fatigue first, then pain, because it's improper loading of joints. So then you have to strengthen your thumb. And you strengthen your thumb away from the violin, by the way. It's not, well, violin you have to support, you have to pay attention to the posture of the thumb, but you strengthen it outside of the violin. Okay, next question. The cons of tall chin rest, physical sensation to instrument, or tall shoulder rest, higher arm angle without less legends like Sigetti, Steinhardt, Chris are managed, but what risks of scoliosis? Um, well, first of all, risk of scoliosis is always there, whether you play even with shoulder rest or not. Yeah, if you have any kind of form of constant contraction of some muscles, I mean, for a long time, and it pulls pulls the spines out of the shape. But everybody, I mean, almost everybody has scoliosis. I mean, everybody of our profession, I would say, has scoliosis to some degree. Okay, so here's a little thing from my history. Some of my students will know, people who know me. So I was 10 or 11 when at some annual exam, the doctors noticed that I think the girl is developing scoliosis. So my mother had to take me to like uh, the doctor, the specialist. And so the doctor looked at me and I had to bend forward, all of that stuff. And they looked at my spine and then they put me out and they talked to my mother. And of course I could hear everything anyway. But so the doctor said, yeah, she has scoliosis. It's definitely brought up by violin because apparently it was like going slightly there. Said, oh, she immediately has to stop playing violin because she would be, if you don't do this, if you insist, you're a bad mother, and you and she will be a cripple by the age of 25 or 30, and you have to do these measures to protect your child's health. It coincided with a period of time when I didn't want to practice really, and so I was listening to this and thinking, oh yes, maybe something else. I really wanted to be a circus artist at that point. I wanted to be a trapeze gymnast. Okay. Then the doctor says, or you can at least move her to a flute because, flute, they're playing like this. And so that will balance her, from here to here. She will be more balanced for scoliosis. I mean, she's still very young, scoliosis will go away. But by now, she has to sleep on the planks on a very, very hard surface, no nice beds, and never do any gymnastics for some reason, whatever. Don't do gymnastics, it will make things worse. Well, my mother, luckily, did not believe in this. Although I was very excited because I heard this and I said, oh, well, what about me playing flute? Because I knew that if you start flute at 10 or 11, it's not late at all. We thought that starting violin at 10 or 11 is late, which, by the way, it's better to start earlier, but it's not late. Really, if you have talent, it's not late. But anyway, in flute, definitely, you can start even at 12 or 13 and still become a perfectly great professional flutist. Anyhow, so my mother said, no, give me some absolutely horrendous, which turned out to be horrendous, reasons why not. Because nobody will take you, even your lips are too fat for the flute. And plus, you will whistle your brain out. You will be completely an idiot if you play the flute. Can you imagine? Of course, she didn't really mean it. She just wanted me to stop thinking about any kind of other instrument, as it turned out later. But at that point, I believed everything. So I stopped thinking about flute and I kept playing the violin. But later, I did get into the gymnastics, and it was perfectly fine. And my scoliosis, I don't know, maybe it's there, but it certainly doesn't bother me. It didn't bother me a whole lot. So I wouldn't worry about this too much. Okay, so let me so bad. Is orchestra playing known to cause injuries given long rehearsal times, lots of soft playing, tremolos, etc.? Any tips to avoid overloading? Orchestra playing definitely causes more injuries. Not even long rehearsal times, but also because sitting actually is still worse for us. I mean, both are not very good. Not sitting, not standing for a prolonged period of time, but posturally, sitting in fact is worse for more hours than standing for the same amount, a number of hours. So plus, when people sit, like right now I'm sitting, I have a nice lumbar support here, and I'm already very aware of my core muscles, like the lower abdominals. And yeah, you have to sit with your lower abdominals on, then you're protecting your back, because otherwise for long sitting, it compresses our back, lower back especially, and a lot of problems start happening because of this and that. And then this, we get fatigued, we sit like this, terrible. So Having a lumbar support in orchestra is very helpful. Many orchestra players just carry it with them, or they can maybe leave it in the place of rehearsals if that's the only place the orchestra rehearses, and they can maybe leave it there in our lockers, or just bring it with them. Like if they play some gigs, people do this, and that's a very good idea. So that's number one. Number two, um, soft playing tremolos. Well, soft playing, the meaning like holding the violin, the bow up. If it's especially if second violins, and if you have to do this for a long time, yeah, it's terrible load here. It's just absolutely terrible. So what can you do there? Well, I mean, depending if it's a rehearsal and you know that you're fatigued, just I would fake, honestly. A little faking in there is not going to hurt the sound of the section. The only thing you don't want to do is to hurt the sound of the section. So if you're fatigued, that is a good idea for a while. And then you rest and or just not play, just skip a bit. Now in the concert, of course, you will play, or in the show, if it's a show, yeah, you will play. Another thing is, of course, to ground, if you can do it at the tip and not on the G string. Some people I even saw doing this. So right now I'm sitting here, so I'm putting my um, the part of the hand on my knee here, right? And sitting like this. And so basically I'm doing just a little tremble. Whoops, tremble here. You can do that. The same idea. It's orchestral playing. So you're just contributing a little bit of the soft sound to the group. Not very desirable in the long run. You should always do this, but yeah, your health should come first, because if you cannot play, then well, the group also loses the section. Avoid overloading. Yeah, just stop playing for a second and come back. Asking about, I use the left hand for everything. I'm left-handed, okay? Using the right hand with the bow is not good because I do not control well using the right hand. Give me your opinion. Yes, it is true. For many left-handers, it's harder to acquire good bow control, or bow technique, rather, bow hand technique. It's harder, it's true. But it's very possible. I've had quite a few left-hander students who rose to very great professional heights and learned all the bowings. I mean, it took longer for many to learn than people who are right-handed, because yeah, people don't realize that the bow hand is harder than the left hand. It looks like, oh, this one is harder than this. No, because here we are doing with the stick through the medium and not just immediately, like the fingers on the string. And plus, this movement is much more natural to do on either hand, and that one through something with this coordination of all kinds of muscles and everything, it's much harder. So yes, for left-handers, life is tougher, but it's certainly possible. Just will take more attention, more focus, and longer time to uh, to get to the same results. Would you recommend? What I would recommend raw data 23 for strengthening the right hand. You know what? Row 23. Which one is row 23? 22 is the D minor. 23, I don't remember right now. I need to look at it and see what the. Yeah, I do remember it. I do remember. You know what? I think that it's good to do the strengthening of the right hand. It depends on what bowing we're strengthening, what function in which situation. In general, the strengthening of the right hand is best to do through physical exercise, actually. But certain movements, that will be row 23, can be a lot of Kreutzer etudes, the ones involving martelet, the one involving anything a slightly off string, because then there's a lot of holding. Yeah, those would be specifically strengthening the right hand. I mean, it's a little bit too general, you know what I mean? It's like a little general. I don't know which parts of the right hand we want to strengthen. But in my opinion, truly strengthening the right hand, like the right arm function, it's actually physical exercise is the best. Thirds. 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 How to reverse burning sensation in the bow hand tendons, in the knuckles between 3, 4, thumb extensor, pinky flexor, wrist on the supinator. It's not strong but very dismotivating. Burning sensation. Burning sensation is not good. If it's already burning sensation, it means, well, you know what, in this case particular, if you already have it there, I would honestly, again, as I said in the beginning of the stream, I am not a medical doctor. Yes, I do know quite a bit, and I can make certain suggestions, but when the burning is concerned already, that's step up. Well, basically, it tells you that some nerves are firing, saying, there's fatigue happening. We don't want to get more conductivity to this part of the body. So something is stressed somewhere. And where it may be stressed, as I talked in the beginning, it can be in any part of these nerves going to this area and firing that response. So I would honestly go to a good physical therapist, specifically who specializes in hands. Yeah, that's my advice here. Even if it's not strong. But yeah, you're right. My lessons are really a treasure, Theo. Thank you so much. I developed. Thank you. It's good to hear. That's why I do them. Let me see. I skipped over some questions. I used to have an elbow vibrato, but now lost it. When I try to vibrate, my hand becomes stiff and tired immediately. How can I solve this problem? Okay, elbow vibrato. You know what? The one thing that we all do in this business, we don't have terminology that is like carried across one teacher to another. It's a big problem. So we all, make our own words to call whichever. So elbow vibrato. Elbow vibrato means this vibrato is this elbow vibrato, or what is elbow? Probably, right? So I would call it I usually call it the arm vibrato, which actually really is forearm vibrato. If that's what you mean by elbow vibrato, this when the wrist itself is not. Uh, this would be what I call wrist vibrato, what most people call wrist vibrato, and most people call this arm vibrato. Elbow vibrato is that one. So if that's the one, now you try to vibrate, my hand becomes stiff and tired immediately. Now, hand kind of indicates that you do that sort of vibrato. If something gets tired immediately, it means there's too much tension involved. That's all. That's number one. So if something gets tired so easily, that means tension is there. One needs to find out why tension is there. And here I must say that there are people, quite a few, by the way, people who need to have a little tension to perform a specific movement. And it's sometimes due to low tone muscle that people are born with. And there's nothing, you can develop it a little bit, improve it a little bit, but you still will be low tone muscle or rather a high tone muscle person. And it could be because of this, it could be because of poor proprioception, or for certain movements. So when the body cannot find itself in space basically, and it needs to have a little bit more input, and that's when we tense up something to feel the movement, to get the feedback, like, oh yes, I'm doing it, this movement is there, that's where it's happening in my body, you know what I mean? So that is happens. So maybe that's what causes it. The way to discard the extra tension is to find out where that tension is, or just try to vibrate and say, okay, I can do the same, I can get the same sound, but I will do less. sound, stay. Release something. You don't need to know what you're releasing. Just like let go, let go. It usually does happen. So yeah, you need to find the cause. What is getting tense? Were there physical gym classes when you were studying, considering the education system now lacks beyond in that aspect greatly, including nutritious? No joke. Prison meals are more nutritious. Yeah, you're right. No, well, there were physical and gym classes, but when I was young, I was very not very smart either. So I avoided gym as much as possible when I was young. Like we all, if we could skip gym, we did because we were musicians. It was so bad. Um, so no, there wasn't anything in place, and that's how I got my tendonitis partially. Also, if I were stronger here, I probably wouldn't have gotten it, honestly, at the age of 19. But after I was 19, I started doing exercises. I was immediately put into swimming. Swimming is great, like really swimming. And I became much stronger. Things went away. And yeah, whenever I had to recover from, I had lots of injuries over the years, not so much related to playing. The playing was the ulnar nerve. That was related to playing for sure. And playing well, and also I had an accident, and the accident plus the playing did this. But then I had some sports injuries. I had sports injury here. I had sports injury there. I was falling from rollerblades. I was running into the wall playing, um, whatever it's called, racquetball, stupid things, right? Um, so, but recovery still, you recover and you have to get in more physical shape. You do exercises, you get better. So, yeah. You're a self-learner and you really start understanding the violin thanks to you. It means how things, I mean, how things really work and mechanics, how to play it naturally. Well, yeah, and that's true. You can be basically self-taught if you understand the mechanics and how to think. Suggestions for thicker pads for taller violinists with long necks, such as the pad Oyster used that no one really knows. Yeah, Oyster, my mom also used the pad, and although she didn't have this long neck, but I can't find those pads anymore. They used to make them in Europe at least. Um, what I don't know what Oyster had, but probably one of those. They were really nice. Um, they were pads and a little bit like on little legs, but they were still made out of the same kind of foamy but hard foam material. Not, and the pad itself was very small and it would be just kind of like you move it. It would be attached here and then on the um, well, like on a little collar sort of, and you could move the pad here, to find the best part. But basically playing with such a pad, it's kind of in between the shoulder rest and no pad at all, or complete support in the hand only, so yeah, it was about a lot of balance, more balance. Nowadays, I think the closest here you could go with maybe they're the foam things, like sometimes they're made like violin shape. I think they're called, one of them is concertmaster, the other one is soloist or whatever. So they're foam pads made in the form of violin, and they're self-adhering to the violin, so you can just put them there and not have any attachments, which is good. So those, many people just create their own little pads, just like piling them up and then gluing them together and finding that. There are lots of foam pads that one can definitely experiment with. But yeah, what Oyster has used and what my mom has used, even, I don't know. They're gone. You have problem with your vibrato. I am so sorry, but right now we're just dealing with injuries. Okay. So, what should you do if you have a tendonitis in my left hand arm since 2 years? I kind of need some pause every 5 to 10 minutes so can refuel. That is from Exotic. Now, what I would recommend, I don't know if you have gone to physical therapy, actual physical therapist to evaluate and treat you, or you're doing home treatments. If it's home, go to really find a really good physical therapist and go with a regiment of exercises. It looks like you probably are not toned enough. in where you need to be toned, and possibly you have too much tension performing certain movements, um, or you didn't heal enough. You didn't give yourself enough healing. Sometimes you should be away from playing for 4 months, 4 or 5 months, completely no playing, where you can practice mentally, by the way. The benefit of etudes, are they necessary to be returned to in matured adult life? While not to prevent injury but refresh the physical medical condition. Heard often, Kogan often did. I don't know if Kogan did etudes. I never heard him doing any etudes, of course, and as I said, I only saw him in that institute receiving some overall medical assistance every week. So I don't think etudes are that necessary. But I mean, if you find them helpful, if somebody finds them helpful. Some people like etudes more than they like exercises. Some people like exercises, some people don't like either. And if they already formed musicians, I mean, they could, scales, I would still do scales and some scale exercises, yes, just to maintain the physical running shape. But other than that, you can do it on the material, on the repertoire, as far as I'm concerned, you know. Um, but I love etudes. Perfect. Personally, I'm an etude person. I like them for myself. Learning independently on my own, your videos are helpful, and unfortunately in the Middle East, Jordan, and they're no good teachers. Do you have online violin teaching? I I do in principle, but I am so overloaded that right now I cannot. I don't do any lessons in addition to. But if and when I am a little bit less busy, for instance, on vacation, right now it's the end of my vacation, my summer vacation. And then I could, give occasional lesson or two. Also, I do know some very good people who do teach online, and I could recommend them. So if you want that from Middle East, Jordan, write to my email that is attached here. We will put it in the description or in the chat here. That violin class. It's called Violin Class USA @gmail.com. That's the email that belongs to this account, violinclassusa@gmail.com. Write to me personally there, and I will connect you to some very good teachers online. You're very welcome, very welcome. Let me see. Will we see you see me on tone bass? That video with Kurganov, yes. Well, it depends on tone bass. If they would invite me back, I will gladly be there. It just, I don't know. I would like to. If they ask me, I will. If there might be less risks of scoliosis, neck and lower back, so even Kogan suffered injuries, in what way? Were there other? No, Kogan. I don't think Kogan's was related to. I mean, I don't know for sure. I don't think his was related to scoliosis. I think his was related to just a lot of tension. He held tension in his shoulders. I would imagine he had a lot of compression in the nerves coming out of his neck. He also was quite kind of a bitter person. As I said, he was very high-strung individual, very caustic. That kind of. It really helps if you have a sunny personality. If you're you can be perfectionist, but yet still be able to be laid back. He didn't know how to be laid back. He was very nervous all the time. He was a very nervous performer. He would get very nervous before going on stage. Even though he played all the time, he would still get exceptionally nervous. And that all, of course, produces lots of tension. And he would play, his technique was phenomenal. So he could play through that tension. I don't think it was scoliosis at all in his case. Right hand tendonitis in my wrist ruined my career. Wow. But I can play without pain if I don't play a lot of spectator or tremolo. Spectator? I don't know what that means. Spiccato, maybe? I don't know. I'm working on addition, fortunately not require Mendelssohn Scherzo ideas. Yeah, I mean, mental practice of the bowing. Mental practice, because if the mind you can with your mind, you know what movements you will be doing, and you rehearsing in your mind, then you're not stressing your body during that movement. Meanwhile, the movement does get rehearsed. If you do it really, really properly without moving a muscle, the movement is getting rehearsed. So yeah, I would use it in this situation. Good advice in regard to seeking the care of PT was having numbness in my hand and the, yes, of course. Oh, if you have numbness, absolutely. The cause was in the shoulder. Yes, that's exactly what usually is the cause. Numbness and tingling here, first cause is usually right there somewhere in the back of the shoulder, or sometimes in the armpit, sometimes in here. Those are usual causes of the numbness. Spiccato, yes, that's what I thought. Spiccato. Yeah, well, spiccato, spiccato is complex, very complex thing. Um, so, yeah, I would just say mental practice. Yeah, if it's because of the probably supporting of the arm. What is the best starting routine to start with a violin before the real practice? What should I do to practice well? Um, the routines are you have to find your own routine. Honestly, I know you would like to have a prescription from a doctor. I am a doctor, but not to that degree. Nobody can do it for you. You have to develop your own thing. That, for instance, when I was younger, I always practice, always warm up on scales, like, and I would be playing real scales, like you 4-octave scale here and there with acceleration many times over, just like you're supposed to. And then you do double stops, also scales. And then you do, and after that, usually in my younger days, I would just be already with tendonitis symptoms, just because I would be overdoing it. For me, it was not a good way. For many people, it's a wonderful way to warm up. For me, it never was. So for me, what was more effective later, I would start playing something, some cantilena, some slow piece, which I learned before, just playing it basically kind of for myself, and with nice vibrato, or just several notes with nice vibrato, and that vibrato will warm up my hand. And that was great until I had some kind of injury because I fell, whatever, was doing something sports like. Fine. Then I started doing another type of warm up. I would run. I would run, that's what I do to this day. I would run chromatics like this. Just like that. And I will do this like for 3 minutes consecutively. And right now I'm very stiff because, first of all, air conditioning is blowing on me here. And I haven't played at all, I'm sitting here. But so I will do that stuff for like up to 3 minutes from cold. And then I put my violin down and don't play for 5 minutes, and everything warms up and says thank you, and after that I can do whatever. So that's my warm-up nowadays, actually. So it's very individual. Some people will, well, and again, before that, of course, stretching is nice. Going the corner stretch, I usually go to the corner and do my corner stretch, which is in my video. Sometimes I would do, depending on what I have, I would have that kind of stretch here, just to make sure that, but then of course I'm fast right now, but you are sitting in the stretch for a while, you feel like it's stretching, then you can do it at the angle. I have it all in my videos. So yes, I do those depending on what shape I'm in. Walking, or, if no other health condition exists, you can jump in place. You just basically have to get your blood going. Very, very helpful to warm up. Warming up really is just really warming up your body. You can warm up by putting warm stuff on your hands and arms and in here, just like literally warm up with the warm up pads, whatever. That's good. And then the warm up is in the brain, knowing exactly what you will be playing and how you will be doing this, and what goal you have here to achieve. That's also a great warm up, because people a lot of times, like right now, I showed like I would do warm up if I don't have any pads and heating around me. I will do what I just did. The running of it's compact fingerings of running chromatics, and that warms up my hand. Physically warms it up. But otherwise, I could just stick it under warm water and warm it up that way, and then I can play whatever. So it's what it is. But yes, to know exactly what you want to do, what your goals you want to achieve, that's the best way to start practicing. Certain nutrition diets, practice habits, schedule for large repertoire that are more beneficial for injury prevention, since violinists are in many ways like athletes. Absolutely. Nutrition diets eliminate or reduce sugar consumption, because sugar leads to cramping. If you drink coffee, you can drink coffee, but without sugar at all. No sugar in the coffee, no sugar around the coffee. So caffeine and sugar are the worst offenders when they are combined together. So yeah, sugar is worse than coffee. That's already known. Then of course you need to basically don't eat like bad stuff. Don't eat something that will junk up your liver. Oops, what am I doing here? I'm doing something with the mouse, and I don't know. And that is like very fat uh, diet full of fats, poorly digestible diet. Yeah, it's very important not to do this. Um, the rest of that, wait a second, I did something here. Now I cannot undo it. I have a problem here, which I don't know how to fix. Come on. Oh no, now I'm completely away from. I am back. I figured this out. Okay. Schedule for large repertoire. Yes, alternating things, knowing what you need to do every day and what you don't need to do every day. That's important. So you don't overload yourself with everything. Even when you prepare for like big international competitions, I usually would look at the repertoire my student plays and will basically suggest like, okay, this is that you're doing this and this and this today, this and this and this second day, third. This one you can do every third day, which means that you carry it in your more in your mind. So your mind has to be of bigger capacity. When you have more repertoire, it means that you can hold more stuff in your mind. It's not about physical playing so much. Well, it is, but it's secondary. First, it's all here. So um, yes, thank you. Go to the beginning of the chat. Yeah, please. There are the videos on stretching. Okay, so then somebody says something about, I don't know what it is. Okay, I don't see any more questions. And actually, I do see that my stream was supposed to be 1 minute, 1 hour. Now it's 1 hour 27 minutes. So I'll wait if there's any more questions about the injuries and things. But if not, I asked about ulnar nerve recovery, ulnar nerve. Oh, Guillermo, hi, are you there? You're there. Something might be not applicable. You know what? I don't see where your other question is. Hi, Guillermo. You asked about the ulnar nerve recovery for I cannot see that question. Could you repeat it? Oh, wait a second. I missed about. Oh, okay. Never mind. I went back and now I see them. Okay, MD asked, have you ever known anyone who got proficient with the violin after having a previous structural hand injury? I personally don't think I do know, but I knew people who got very proficient, like I say, on the piano after have broken fingers and thing. If that's what you mean. But I know people who had Do I know? Well, I mean, I do know people who, for instance, had the breaking of the arm, forearm, and then recovered. Yes, but Boeing has specifically. Nobody comes to mind right now, but I'm pretty sure, yes, I've met people who had all kinds of. Well, I mean, the former concertmaster of Dallas Symphony had accidents, car accidents. He was run into several times and had horrendous accidents, horrendous breakage in arms, in collarbone, broke his spine even, but luckily didn't become paraplegic or anything like that. So yeah, and completely returned back to function. So yes, that went that yeah. So central sensitization in my nervous system was damaged from years of overuse. Oh, bad. What is the best way to return to playing after chronic injury? Very, very little by little, and constantly observing whatever that other injury was caused by. Yeah, only that way. Okay, so then was the tone bass question. Um, where is again? There was somewhere Guillermo's question. Would you share how you recovered from? Would I share how I recovered from ulnar nerve injury? Okay, I see it now. I don't know, I missed it before. Um, so I recovered by going to this natural doctor. It was he is a chiropractor who doesn't do a lot of chiropractic, but he does a lot of what is called applied kinesiology, muscle testing. And then, but he's very peculiar his own way because he's developed that stuff completely out of the mainstream kind of thing. He's a very knowledgeable person and very good. And so he is the one who discovered that I had chronic, spasms basically in certain portions of my muscle. So the way he dealt with them, it's not just massage. It's not a regular massage. I went to massage before, and it did not help greatly with that problem. But once he found these 3 points in which the electric current wasn't running properly, and he addressed it by, it feels like a deep tissue massage, feels like a trigger point massage, but it's not trigger point massage what he does. And people like him, he's not the only one, of course, but people who use this knowledge and techniques. So they're stimulating certain fibers of the muscle exactly the way should be stimulated, and not just, like this, like uh, massage the point. No, it's a certain way of movement in that little area that restores the proper electrical current running through the fibers, muscle fibers. And there were 3 of them. So one of mine was, let's see, it was right here. The other one was right here. And the third one was right in my armpit in a certain place, very deep into the armpit. And it's really a painful part, to try to get there. So, yeah. So he addressed those several times, and then it stayed. And then I also found out that certain foods that back then I ate, it's not like specific foods, I cannot tell you, but I know for sure sugar will be involved usually. But yeah, it was specific foods of some sort that I was eating that would not allow this to stay in a proper way. And again, there will be more tension in those 3 spots. But really, they came about not because of food, they came about because of overuse, because of this stuff. You cannot find the title of the book about mental practice. I will put this book here, okay, in this chat after the stream is over. I will put this book here again on mental practice. Okay, I remember her name, Malva Fremuth. That was the book by Malva Fremuth. There must be many good books by now. Again, her book is the old one. It was in 1990 something, when I first got it. But right now, there's so many books on mental practice. I'm sure all of them are very solid and very good, But yes, I will put this here. Limits in regard to duration of practice sessions. Limits are, as I said, nothing longer than 15 minutes at a time, uh, because the shakon is the longest piece, goes for 15 minutes. Nothing, no more than 14, 15 minutes of holding that here. Okay, so I would do less usually in practice until I'm ready, will be performing shakon. Then of course I will be playing that, here, holding it. But otherwise, less than that is good. And overall duration, breaks and breaks in between. And when you do breaks, not to sit with a phone doing this or computer doing this, but stretching, moving, doing this sort of things, mobilizing all of your joints. Yeah. Do you have any advice for orofacial injuries such as TMJ? I don't. Yeah, I don't. No, I would tell you, I don't know. But here in this book, they might have it. I never had TMJ, so I just know that what I recommend with people who do like is to practice with a brace. To get that brace. I think is it brace or what they like football players. I think they use it, mouth guard. Yeah, mouth guard. They just cut off that little thing that protrudes here, and practice with that. Practice with this. Sleep with this is recommended. But yeah, personally, I haven't dealt with this. Could I keep doing without shoulder rest even if I have problems with my cervical vertebrae? You could, if you're very, very, very careful and not raising the shoulder. I would say that would be my response. So I think that's good for now. We're here an hour and 36 minutes. Most of you were here for all this time. Many people were here. Um, and I thank you all for your questions and for your company. And I hope that this has been helpful. And I know that um, you could only those who are subscribed could ask questions. So if you're just watching and you're not subscribed, please do. If you find it helpful, it helps everybody if you subscribe to this channel. And then you will be able to ask questions also. All right. You're all very welcome. And I will see you all later.